بريك تايم الحين.
يعني 15 ربع ساعة. جبت جاكيت اتفسخت هنا في البيت.
How's your finger?
Hello, my dear. I could not recognize you. You look beautiful.
Good morning, everyone. We will start today our advanced wound care. I hope you enjoyed the lecture yesterday. Today we will start with using technology to improve the wound outcome by Ms. Ala Sharif, wound care team leader in Dammam Hospital.
Good morning, everyone. My name is Ala Sharif, wound care team leader from the Dammam Medical Complex. I want to, before I'm starting my lecture, to thank Ms. Malak and Arwa to invite me to attend and present this presentation. I hope to get the knowledge, more knowledge from this one. I will explore the most advanced and technologies we are using, even explore one cases we are treated and managing in our hospital. Outlines, inshallah, we will discuss in this lecture the introduction to the process and phases of the wound healing. What to use for the wound stuck in inflammatory phase or non-healing or chronic wound. We will discuss the modern technologies for stimulating and treating in non-healing or chronic wound. I will show you one case in my institution. This is as a case study. We are talking about the wound. What is the wound? The wound is it's defined as breakdown or disruption of cellular, anatomical, and functional continuity of the living tissue, and may be caused by several factors. Maybe this break happened by physical, chemical, thermal, microbial, immunological insult. You know, if you have of your wound happen, my hospital is suffer. It's more burden, especially if that wound is non-healing and chronic and take long time. So, the chronic wound is the one stuck in one of the processing of healing process. So, we are talking about the healing process. Sometimes the chronic wound, if not heal properly or take longer, that we have to look at and find another solution to become this non-healable wound to healable wound. So there is, we are facing two types of the dressing, or before we are using something traditional. This is mean conventional wound dressing. But nowadays, because of the increasing number of the chronic wound and need to solve it, because what is happening in the chronic wound? This is factor affecting related to the comorbidity, like vascular disease. We have a lot of patients with diabetes, vascular insufficiency, and even immune. So the researcher, all they have to find new technology. This is where you are exploring the new technology. This is called regenerative and by using bioactive and biomaterial matrix. Okay, before we have to know the normal process of the healing. There is 4 stages or process. If the wound happened, they are passed through the 4 process. The hemostasis phases, this is the first one. This is starting from day 0 to the day 3. What happened in this one? In this phase, we are starting to vasoconstriction, platelet activations, fibroclotted formations, activation of the coagulation cascade, and collect reaction. This period, what is expected from this period of this phase to stop the bleeding? This is the one. Phases 2, we are talking about the inflammation phase. The inflammation phase and proliferation phase is taking the same period together from day 1 to day 25. What will happen in the inflammation phase? Inflammation phase, you have to happen with vasodilation and immune cell movement, bathocytosis, release of the cytokinase, growth factor, formation of the temporary tissue matrix. What about what is expected from this period? What are outcome from this phase? You will see the redness, pain, swelling, okay? What about the proliferation phase? Proliferation phase, now the fibroblast migration, collagen synthesis, and angiogenesis, growth factor in new blood vessels, epithelialization, granulation tissue creation, and wound construction and re-epithelialization. What expected, what come from this one? What I told you, this is a new blood vessels. The last one is the remodeling or maturation. This phase, it takes from 20 days until a year. Here what expected? Regenerization collagen, development of the scar, remolding and maturation of the scar, restoration of function. We expected this period 80% of the strength of the tissue matrix. Okay. We are focusing now to you about a non-healable or non-healable chronic wound. But we have types of the non-healable or non-healing wound, like diabetic foot ulcer, pressure ulcer, and venous leg ulcer. So what that means, non-healing? Non-healing means it's take down the period of that means this wound is stuck in the inflammation or one of the process healing. It cannot pass it to the next process. So, and the timing for the closure is take more time, and size of this wound is not changed. So we have to find another solution and using the technologies to solve this problem and move with this wound. Okay, we're already talking about this is the traditional, what means, this is what is the difference between the conventional and regenerative. A conventional, a traditional way usually goes with cotton, like the bandage, while the regeneration, we are using the advanced technology, fibril, films, hydrogel, biomatrix, all this one, this is advantage. This is advance. This is the new technology or models. We will see, if you deal with it, we see the nano medicine, debridement, shock waves, hyperbaric, topical oxygen therapy. All of these is the new technologies now exist in in the hospital and the market to treat the chronic wound. Now I will show you one of technology we use in our hospital. This is the shock wave therapy. Shock wave therapy, we use it with one patient with diabetic foot. The surgeon decided to do the amputation for him, but after discussion and assessment the patient and do the we're trying to give him chance. So we are using the technology of the shock wave therapy. What is the shock wave? Shock wave is a highly effective shock that initiates biological regeneration process at the cellular level. So, the characteristic of these waves is highest peak pressure, a fast pressure raise, and short life cycle and positive and negative pressure phase. Okay, what is the stimulation? What is the effect of the waves or shock waves to the tissue? It promotes its own production of the growth factor, also promotion of the blood circulation and development of the new blood vessels. This one, this picture, already they use the shock wave in the mice, okay, with animal. But there is good effect with human. So, what I told you, the stimulation of the waves, as there is effect of bacterial effect is become the infection is less, reduction of the inflammation process, and also bioengineering the tissue regeneration and migration of the stem cells. Okay, what is the side effect? They told you if you minimum, but if the side effect there is, we will find some of symptoms like redness, swelling, but this is very rare. We already tried this machine with 5 patients, but the most complaint is the sound only because it's hard, high volume sound when you are using the shock wave. But we can notice little pain, shock wave treatment, nausea during therapy, tingling during therapy. But most of the side effect is minimal. Okay, I will make short regarding the preparation for the treatment or during the procedure. What we need before starting the procedure, we need to do your assessment, cleansing the wound. This wound need to use the ultrasound gel and cover by the Tegaderm. Shockwave need the water media to transmit that wave from the machine to the tissue. So we need also to take the measurement. Why we take this measurement? Need to take the width and the length. The width and the length, they give you, regarding to the manual, how many shock I can give it, regarding to the size of the wound, how many shock I will give to this patient in this session. Okay. After therapy, nothing to do, just remove the ultrasound gel, do the cleansing, do dressing, and cover. Nothing, but just need to follow up and monitor for the patient, because the session, it can repeat after 2 weeks. And each 2 weeks, I have to repeat the session and take the measurement. This is the table. And when I take a measurement, I will find the cross line, the length and width. Length and width, they give you like, for example, if the width of the patient is 6 and length Blink on it. Yeah, this is the height and this is the width. The cross here they give you number. This number, how many shock I will give it to the patient. This is cases use the spark wave. You can use in the post-traumatic lesion, post-operative healing diagnosis, diabetic foot, burn patient. All of these cases show you after 3 sessions improvement and till to the healing and closure. This is one case. I will show this video for our patient. دون العرض. ما شغالة. طيب. No problem. I will already next slide. This is one patient. I'll use the spark wave. Patient presented with diabetic foot ulcer on the left foot. The ulcer measure, this is the initial, is 13 multiply 25 centimeter. Exhibited signs of the chronicity with granulation tissue, indicate delayed healing. The patient has history of diabetic-related complication with contribution to the poor wound healing. Device utilization, the patient has been undergoing treatment with shockwave or another, this is the device name is Dermagold device for 2 months as a part of comprehensive care plan. The Dermagold device utilized the spark wave technology to stimulate the blood supply to treated area and by activated the blood factor and reinitiated significant healing process, reducing inflammation and promoting tissue regeneration. This is initial. This is the initial one. Already first session in 23/7/2024. The measurement of this wound is 13 multiply 25 centimeter. We give to them 5,500 shock applied during this session.